I am Dr. Shridhar, Interventional Cardiologist from Kaveri Heart and Multispecialty Hospital, Mysore. If one has to be sure that heart is healthy, there are two things. One is subjective and objective. Subjective means one is risk assessment, risk factor. Risk factors means risk factors for developing any heart problems, like diabetes, hypertension, or family history of any heart-related problems, smoking, substance abuse, high cholesterol, and family history of heart-related problem. All these are risk factors for developing heart problem. If patient is having these risk factors, they have to be careful. Second thing is any symptoms. If patient is like able to walk 3 to 4 kilometers without any discomfort, patient is able to do brisk walking, able to walk uphill without any chest pain or breathlessness. Generally, it is said, it is not absolute, but generally it is said that they are actually okay by heart wise. And next is objective assessment. This objective assessment, we have to go stepwise. First thing is ECG. As far as cardiac monitoring is concerned, first thing is electrocardiography. We have to do ECG. Suppose if ECG shows some abnormality, it can pick up lot of, it can give us lot of clues like rhythm abnormalities, any old heart attack, fresh heart attack. All those things can be picked up by ECG. And if ECG is abnormal, patient has to go for further investigation. Suppose if ECG is normal, still patient has to go for further investigation, like echocardiography. Echocardiography means scanning of the heart, which will give us like structure of the heart, function, pumping function of the heart, and any congenital abnormalities of the heart, or any pumping function or stiffness of the heart. All this can be assessed by the echocardiography. And suppose if echocardiography is normal, then next step of the investigation is stress test. We stress the heart by either by physical exercise or by giving some injection, like a treadmill test. We stress the heart by making the patient exercise and then take serial ECGs. And sometimes we do echocardiography by giving injection. If patient is not able to exercise, we do physical exercise and then do echo. Next is like we can give injection and then take stress MRI. We can do stress MRI. Suppose treadmill test or stress MRI or stress echo. If all these things are normal, then generally, like if patient is has no risk factors, asymptomatic, ECG is normal, echo is normal, and stress test is also negative, 90 to 95% of the time patient will be normal, healthy. If any of these are abnormal, then according to patient symptoms, we have to further evaluate the patient. Yes, definitely. Because generally, especially young patients without any comorbidities like non-diabetic, non-hypertensive, even non-smokers, without family history of any heart-related issues, can still have heart attack. There are multiple factors, maybe lifestyle and other risk factors will be there, which can lead to heart attack. But still, young, healthy persons can also have heart attack. That we should keep in mind. Thing is, generally we call it as cardinal symptoms of heart. Cardinal symptoms main like chest pain. There are a few symptoms which can tell us that a patient may have some cardiac related issues, like chest pain, breathlessness, or palpitation, or giddiness, recurrent giddiness, or recurrent loss of consciousness. Mainly these symptoms are called exertional symptoms. Suppose if patient is having chest pain, exertion chest pain, that means patient will be comfortable at rest. Once he walks, either brisk walking or walking uphill, patient gets some sort of chest discomfort or chest pain. And if he takes rest, it gets relieved. Or suppose after getting symptoms, if he takes some sublingual sorbitol tablet, it gets relieved. And then again, if he is able to walk, that means generally it is related to heart. That is one thing. And sometimes if it progresses, then patient may have progress symptoms, and he can have the similar symptom at rest also. Similarly, patient can have breathlessness also, and again it is the same exertional breathlessness, and it may progress to breathlessness at rest. And palpitation means heart beating fast sensation patient feels, either very fast heart rate or very slow heart rate, both can happen. And next thing is patient may have recurrent feeling of giddiness or recurrent loss of consciousness. All these are main heart related symptoms. If patient is having any of these symptoms, generally it is always better to get evaluated. These are main symptoms, typical symptoms we call it. But generally, some patients, especially elderly patients, females, and diabetic patients, they may present with atypical presentations like upper abdominal discomfort, nausea, and recurrent vomiting, unusual sweating, and only fatigue, nothing else, and some weakness, fatigue. These are and some bilateral shoulder pain. All these things will be there. These are atypical presentation. They may not have any typical chest pain. This is because of diabetes generally. They will not present with typical heart-related cardiac manifestations. Even in these patients, especially elderly patients, diabetic patients, they should be more cautious. Yeah, definitely. Because in the first question itself, I told there are some risk factors for developing heart-related problem. So hypertension is one of the most important risk factor for developing heart-related problem. Hypertension, it can lead to like heart failure symptoms, because normal blood pressure we call it as 120 to 130. So heart has to pump against a pressure of 120 to 130. Suppose if it increases by 180, 200, then heart has to pump against a pressure of almost 60 to 70 or more than that. So there will be a lot of pressure on the heart. Once heart faces lot of pressure, it becomes, over a period of time, it becomes stiffer and stiffer. Once it becomes stiffer, generally there will be subsequently they will develop heart failure symptoms. Means heart becomes stiffer, and there will be some accumulation of fluid inside the lungs, and patient may develop all these symptoms like the chest pain, breathlessness, predominantly breathlessness, and they may develop other symptoms also, rhythm, heart beating fast, slow, breathlessness, and they can manifest with heart failure symptoms. That is one. And hypertension itself is a risk factor for developing heart attack, that is myocardial infarction. Second, they may present with rhythm disturbance like very high heart rate, very low heart rate. Secondly, then it may not be the direct cause, indirectly it may affect. Yeah, definitely. Because COVID-19 initially, when it was like it started in November, December 2019, it was thought it affects mainly the lungs. It is viral, it causes mainly viral pneumonia, but subsequently it is mainly, it involves lungs, and it causes a lot of clotting disturbance. So it causes a lot of microclots, microthrombi we call it. So it affects not only lungs, it affects almost all organs of the body, including heart and other blood vessels in the blood body. Like if it affects, if there is clot formation in the heart, the patient may present with heart attack like features. Many patients presents with heart attack, and there will be a lot of clot inside the heart arteries, and treatment remains same, but still when tested, COVID will be positive. Generally they will be without any like risk factors. That is one thing. And the second thing, they may present with other clotting manifestations like clot inside any other arteries, like veins, the large veins and other large arteries, and they may present with stroke. That is one. And the second thing, there is something called inflammation of the heart, myocarditis. Means there will be a lot of inflammation of the heart muscle cells that leads to weakening of the heart, and pumping capacity of the heart decreases, and patient will present with heart failure symptoms. And other thing is there will be a lot of rhythm disturbance. Means patient may present with very high heart rate or very low heart rate. And sudden cardiac death is also like noted in patients with COVID-19. These are all manifestations seen in COVID-19 patients. No, not exactly. For the answer for the first part, like treatment of heart attack in COVID-19 patient, as far as treatment is concerned, there is no change as such, because patient presents with heart attack. Treatment medications remain same. Like we have to give blood thinners, tablets, and blood thinner injections, and statins we call. We have to give all those medicines, and we have to stabilize him. And if required, if patient is unstable, we have to take the patient for primary angioplasty, and we have to do primary angioplasty, or else we can give thrombolytic therapy. uh, Treatment modality generally there won't be any change, but only thing is there will be a lot of risk on treating staff, whether it is doctors or nursing staff or ICU staff. Because if COVID, there will be constant, they will be in constant touch with the patient, and a lot of they will be in close proximity with the patient. So there are high chances that they will contract disease. So they have to take extra precaution, wearing. They have to wear proper PPE kits, and then patient has to be treated. So mainly on the treating staff, it's some extra burden. Otherwise, as far as treatment is concerned, there's no change as such. And medication, avoiding of medications, earlier it was told that some medications, especially antihypertensive medications, AC inhibitors and ARBs, like ramipril, enalapril, and losartan, telmisartan, all those things were supposed to be avoided. That's what initial studies told. But as such, there are no published data, and nowadays there are no contraindications to use these antihypertensive medications in COVID-19 patients, unless patient is hypertensive. Yeah, definitely, because sleep is very important for normal health as well as healthy heart also. Because any disturbed sleep, generally we sleep occurs in cycles. Sleep cycle we call. Every 1.5 hours, means every 90 minutes one sleep cycle will be there. So generally 4 to 5 sleep cycles should be there. At least 5 sleep cycles for a healthy heart and healthy persons, it should be there. Suppose if there is any like breakage in the sleep cycle, or any problem or disturbed sleep, or sleep phase cycle disturbance, general patient will have fluctuating heart rate. Mostly it is tachycardia, that is very high heart rate, and fluctuating blood pressure, high. They are more prone to develop hypertension, and mood fluctuation will be there, and emotional disturbance and lack of concentration. All these things will be like reflected in daily life. Suppose if there is a high heart rate, it will definitely affect the heart. It will there will be more pressure on the heart, more stress on the heart. Hypertension also, it affects the heart. So directly or indirectly it affects heart, and there will be a lot of stress on the heart. And especially if somebody is having cardiovascular disease, it's always better to have proper to maintain proper sleep cycle, and uh, yeah, to keep the sleep pattern adequate. Mainly stay fit. uh, Treatment is always there, but still prevention is always better. One is lifestyle modification is the most important thing, because once we modify our lifestyle, it will take care of our risk factors, which will cater for almost 50% of the problem. Maybe more than that. Which may be diabetes, hypertension, obesity, cholesterol, or stress, and even heart rate. If somebody is having very high heart rate, that will also come down with lifestyle modifications. Just by doing normal walking, brisk walking, 30 minutes every day, for 30 minutes, at least 5 days in a week. That is what is recommended. And dietary modification, and avoiding smoking. Smoking is the biggest culprit. Means young patients presenting with MI, because elderly patients generally they present late, but still they will survive. But young patient developing MI, they don't reach hospital. Most of the patients. That is because of they don't get time. So generally they will before us reaching hospital only they develop complications and they will develop cardiac arrest. So avoid smoking, avoid substance abuse, avoid alcohol, and healthy lifestyle. These are the main lifestyle modifications. And if these things are taken care of, generally 50 to 60% of your heart will remain healthy. Rest of the things, you have to go for investigations, and then probably if the problems are there, you have to treat for that. So stay healthy, stay fit.